Good morning, wherever you are. This is Luna Vale from ConferenceHype. Our segment will focus on pancreatic enzyme replacement therapy for exocrine pancreatic insufficiency-Insights into prescribing practices. From the 2026 August 8 edition of Indian Journal of Pediatrics. Background: this study reports pre-discharge survival and clinical outcomes of very preterm infants and very low birth weight infants from a tertiary care, inborn neonatal unit in India. Methods: in this retrospective study, inborn neonates admitted between 2013 and 2022 over a 10Y period were included. Results: a total of 2063 VLBW infants and 1663 VPI were analyzed. Discussion: very preterm and VLBW infants demonstrated high survival with low rates of major morbidities. From the 2026 August 14 edition of Indian Journal of Medical Microbiology. Background: Introduction: persistent airway infection by Pseudomonas aeruginosa in cystic fibrosis is linked to internationally disseminated high-risk clones. Methods: we selected SD357 and SD274 isolates recovered in 2018 from 14 patients at a regional CF reference center. Results: SD357 isolates formed tight subclusters, including 2 pairs of indistinguishable strains. Overall similarity was 73.6%. Discussion: findings support reinforcing CF-specific infection prevention, implementing periodic genotypic surveillance, and expanding future work to longitudinal environmental sampling. From the 2026 August 13 edition of Indian Journal of Pediatrics. Background: point-of-care ultrasonography is being increasingly employed in the emergency room as well as in intensive care units to guide rapid management of sick children while avoiding shifting them away from their primary treating physician. Methods: the examination must be targeted, with a checklist approach based on clinical signs, to enable both speed and accuracy. Results: this review brings forth some less explored applications of POCUS in order to expand its scope. Discussion: defined U.S. criteria available in literature for abdominal pathology, as well as established indices, which can be calculated, have been also detailed in this review. From the 2026 August 17 edition of Indian Journal of Medical Microbiology. Background: respiratory syncytial virus is an important global cause of acute respiratory tract infection, contributing substantially to illness, hospitalization, and deaths across all age groups worldwide. Methods: while RSV has long been associated with severe disease in infants and young children, its impact on older adults is increasingly recognized, with evidence suggesting that mortality in elderly populations may equal or exceed that in pediatric age groups. Results: while RSV has long been associated with severe disease in infants and young children, its impact on older adults is increasingly recognized, with evidence suggesting that mortality in elderly populations may equal or exceed that in pediatric age groups. Discussion: this review proposes for integration of routine RSV molecular testing and reporting, with outcome especially in comorbid adults. Inclusion of RSV vaccination in National Technical Advisory Group on immunization deliberations for elder and high-risk groups. Accelerated regulatory pathways leveraging global bridging data and implementation of prospective multicenter studies to generate robust evidence for health technology assessment. Cost-effectiveness and policy formulation. From the 2026 August 12 edition of Indian Journal of Medical Microbiology. Background: autoimmune encephalitis is one of the treatable cause of pediatric encephalitis and is increasingly being recognized as area where timely detection and treatment can limit significant morbidity in such patients. Methods: this observational cross-sectional study was conducted from May 2023 to October 2024 in a tertiary care hospital in northern India. Results: of 188 children with AES, 50 met criteria for possible eye. Discussion: all eye cases diagnosed in the study were anti-NMDAR-positive encephalitis. From the 2026 August 12 edition of Indian Journal of Medical Microbiology. Background: torch serology is frequently used to evaluate pediatric cataracts, but can be misleading beyond the neonatal period. Methods: we report a 2-year-old male with bilateral cataracts and dual Ig-M positivity for cytomegalovirus and rubella. Results: despite initial infectious suspicion, negative CMV PCR, and a significant maternal family history, prompted genetic testing. Discussion: it underscores the necessity of clinico-microbiological correlation and molecular confirmation to prevent misdiagnosing genetic conditions as active torch infections. From the 2026 August 10 edition of Indian Journal of Medical Microbiology. Background: the COVID-19 pandemic profoundly altered the circulation dynamics of respiratory viruses worldwide. Methods: in this retrospective single-center study, 750 patients whose respiratory tract specimens were submitted to a tertiary care university hospital between February 2023 and March 2024 were included. Results: at least one pathogen was detected in 56.3% of patients. Discussion: respiratory viruses continue to dominate the etiology of acute respiratory tract infections in the post-COVID-19 era, with distinct age-related patterns and sustained circulation of SARS-CoV-2. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 15 edition of Indian Journal of Medical Microbiology. Background: Pheochromonum parasiticum is a rare dematiaceous fungal pathogen commonly seen in immunocompromised or post-traumatic patients. Methods: sometimes it can affect healthy individuals too, when there is delayed diagnosis. Results: this fungal infection is frequently missed due to its rarity and delayed growth in routine laboratory diagnosis, particularly when clinical suspicion is minimal. Discussion: hence, this case highlights the importance of reporting fungal infections even in healthy people with long-standing, non-healing swellings. From the 2026 August 11 edition of Indian Journal of Pediatrics. Background: lung point-of-care ultrasound has emerged as a valuable tool for bedside imaging in the emergency and critical care setting. Methods: over the past decade, it has been increasingly used to evaluate not only children with pulmonary conditions, but also to guide decision-making regarding fluid management, weaning and extubation, etc. Results: in trained hands, this modality is comparable or even superior to chest radiography for selected conditions, while significantly reducing radiation exposure. Discussion: this narrative review summarizes the basic principles of lung POCUS, key findings in common respiratory problems in critically ill children, and its clinical applications along with limitations. From the 2026 August 17 edition of Indian Journal of Medical Microbiology. Background: BK polyomavirus reactivation is a significant complication in renal transplant recipients receiving immunosuppressive therapy and may lead to BK virus-associated nephropathy and graft dysfunction. Early detection of viral replication is essential for timely intervention and preservation of graft function. Methods: a hospital-based observational cross-sectional study was conducted among 90 renal transplant recipients. Results: BKV DNA was detected in 28 of 90 patients by qualitative PCR. Discussion: qualitative PCR is a useful screening tool for early detection of BKV reactivation, while qPCR-based viral load estimation provides valuable information for monitoring infection and guiding clinical management in renal transplant recipients. From the 2026 August 12 edition of Indian Journal of Pediatrics. Background: to assess the prevalence of job satisfaction and burnout among pediatric intensivists in India, and to examine factors associated with work-life balance and well-being. Methods: A cross-sectional online survey was conducted among practicing pediatric intensivists across India. Results: a total of 216 responses were included for analysis. Discussion: pediatric intensivists in India report moderate levels of job satisfaction, but a high burden of burnout. This concludes ConferenceHype Journal Club India Journal articles. Which article could change practice, and which journal should we revisit in greater depth? Share this regional journal review with a colleague or your clinical team, add your perspective in the comments, like the video, and subscribe for the next Journal Club.